A South African pharmaceutical company says the recent outbreak of measles in Gauteng and the Western Cape is as a direct result of parents who refuse to vaccinate their children against the illness. The reckless habit of not vaccinating in general could fuel a rise in antibiotic-resistant superbugs, says an expert from the company. Annemarie Blackmore from the Pharma Dynamics pharmaceutical company says it is important for children to be vaccinated in general to counter antibiotic-resistant superbugs. She joins us from our Sea Point studio this morning. Good to have you, Annemarie. Thank you very much for being our guest here.
Good morning.
So we talk about people that, is it fair to just blame the outbreaks perhaps on these parents that are refusing to vaccinate, or is there more to it?
There is a bit more to it. I think in South Africa specifically, what we have to consider is, especially in rural areas, it's sometimes very difficult for parents to find transport, to get the access to the clinics, to take their children for vaccinations. And then we've also had some issues in South Africa with stock shortages of these vaccinations. Yeah. And that obviously limits it as well. And the statistics of vaccination cover in South Africa are really quite alarming. We previously looked at the District Health Barometer, which looked at the 2013 to 14 period, and they showed that about 84% of children in South Africa had been vaccinated, which was 10% lower than the previous year. But even more alarmingly, last week the information came from Statistics South Africa, and they look at a more current measure where they actually look at children in a specific age group and whether they've received all their age-appropriate vaccinations for their age. And those statistics are showing that children between the ages of 1 and 2 years, only 53% of them have received all their vaccinations. And even worse, if we look to the 2 to 3 year age group, only 42% of them have received all their vaccinations.
Sure.
So it's certainly something that is a priority now for us in this country.
When we look at that, I mean, when you look at the percentages and those that have and have not been vaccinated, is it due to the fact that access to the vaccines is becoming more difficult, particularly for the rural areas, as you mentioned? Or are we also seeing a trend of parents who are saying, no, I don't want these vaccines in my child, I would rather go the natural route?
Yes, I think the anti-vaccination drive is definitely playing a role, and it's really born from a study that was published in the UK some years back that linked the MMR vaccine. So that's the vaccine for mumps, measles and rubella, or German measles, and it linked this vaccine to autism in children. And that obviously caused a great uproar, but consequently to that being published, that study was shown to be fraudulent. The data was falsified and it was actually completely withdrawn from the medical literature. And these findings were shown as such in the British Medical Journal, which is a very reputable peer-reviewed scientific journal. So currently there really is no scientific evidence to link the MMR vaccine to autism, but I think that initial fear and uncertainty that was spread through that publication still remains in the public domain with a very big effect to this day.
Yeah, I mean, I remember doing a lot of research as well, you know, when it came to the vaccinations, because I mean, that was the buzz, and everybody was talking about the cause of autism and MMR and this, and you know, you're led to panic and worry about these things. So what you're saying, and we've heard this being said before, I mean, this study was done many years ago, and it was found to be very faulty. In fact, the guy, I think he was on the cover of a medical journal, they had to revoke it and remove that and apologize almost for giving this guy the attention because his studies weren't done properly. But do you think this information has been advertised enough? Do you think people talk about this enough?
I think what I could say is that for parents, if they're making their decisions, it's important to consult a registered healthcare professional. You know, speak to your doctor, speak to a clinic nurse, speak to a registered pharmacist, and be aware of looking at blogs and social media, which spreads a lot of fear and chaos and not necessarily based on scientific evidence. So I think the important thing for parents is to take note of where they take their guidance and their advice from.
Yeah. You know, I was having a conversation with a group of moms, because I mean, my kids are like very many other South Africans. My kids are in the preschool and schooling years, and obviously this is where parents are very worried. And many say, oh, but you know what? I had measles when I was young, and you know, I just treated it and I got over it and I was fine. We move on. Is that a way to think, or you know, these vaccines, because it doesn't necessarily stop you from getting measles, but how do they help? Why should we have vaccines?
Look, vaccines do play a very important role. I mean, the World Health Organization, just looking at measles, the World Health Organization estimates that between 2000 and 2015, the measles vaccine alone prevented 20 million deaths around the world.
Wow.
And if we then look at the issue of antibiotic resistance, you know, one of the vaccines that our children receive in South Africa is the pneumococcal conjugate vaccine. Now, this is a vaccine that protects against an illness called streptococcal pneumonia. If kids had to get that disease, that would be treated with an antibiotic. And the estimate is that if that vaccine could be rolled out globally, we could prevent as many as 11.4 million days of antibiotic treatment only in children under the age of 5 every single year. So you can see there where vaccines play a very important role in preventing serious diseases with serious effects that can cause death, and also misuse or excessive use of antibiotics.
Yeah. Let's talk about the cases, the reported cases that we've seen. So the figures that I have in front of me, I'm not sure if they've changed. You would know more. 31 cases in the Western Cape, 15 cases here in Gauteng, and many are calling it an outbreak. With these figures, do you call that an outbreak? Is it not normal to get so many cases of measles during a season?
I think what is concerning here is the concentration. So the fact that it's in a specific, you know, in the Western Cape and in Gauteng, it's been quite specific in a certain area.
Yeah.
In Gauteng, as far as I understand, a lot of the cases were actually linked to a family where the children aren't vaccinated.
Okay.
And I think what is important to understand is that for vaccinations to be effective, you have to have the majority of children having them. And what we also who we're really trying to protect is the most vulnerable, which is small babies of 0 to 6 months, you know, who are too young to get the vaccination. So if they had to get these diseases, it could be very, very serious for them. You know, measles can cause blindness, it can cause brain damage, it can cause pneumonia. Yeah. It's something that you certainly want to avoid in young children.
There's now, I mean, I got a form from my kids' school saying that this is particularly in Gauteng, you can talk to us about the Western Cape, that they're going to be going on this, the booster. They're going to be going to schools and they're going to actually be giving the immunization and the booster for measles. Do you recommend that parents allow their kids to have this, even if they have been vaccinated? Are you for the booster?
Look, I'm not a medical doctor, so I'm not the right person to make that recommendation. On a personal level, yes, I believe in it because I believe in the role that vaccinations play.
Yeah.
But again, I think if a parent has got any uncertainty about that, they should contact their doctor and discuss it with them, and, you know, it would be their best source to get good advice from.
Yeah, I think that's good advice, because a lot of parents are asking the same question. Should I, shouldn't I? What do I do? Is it the right thing to do? But I think your medical doctor can help. Now, I mean, I know that there's a drive from South Africa to try and eliminate measles by 2020, and they're hoping to do that through vaccinations. Is this possible? Do you think we can achieve this in, I mean, 2020 is 3 years away?
It is very close by. Look, the Health Minister in his recent budget speech did address the issue of stock shortages in South Africa of various medications, including vaccinations, and it is certainly a priority that is being addressed. So I think, you know, we'd have to see how that plays out, but at least it's in the spotlight and it's getting the attention, which means that, you know, things have to improve from here forward.
Yeah. All right. Thank you for this important conversation. I think a lot of parents learning a lot from it, and perhaps just making their minds up as to what they should or shouldn't do when it comes to vaccinations and the boosters thereof. That in our C Point studio was Annemarie Blackmore. She's from the Pharma Dynamics pharmaceutical company, talking to us about vaccinations and why a lot of South Africans are choosing to not go the route of vaccinating their children. Again, we'd love to hear from you. Do you feel that it is right to vaccinate, or would you rather just say, no, I'm not going to do that? I've heard some negative effects of the vaccinations, and I would rather deal with the illness if and when my child does get it. What do you think? We'd love to hear from you. I suppose it's all our choice. It's not compulsory that you have them, but you'll hear from most medical practitioners that they'll say, please do it. It is important that your child gets vaccinated from the day they are born. So we'd love to hear from you. We would love to hear from you. At Morning Live, SABC, that's our Twitter handle. We're continuing to broadcast straight after this break. Your news at 8 will be next.